This podcast is brought to you by Skin Spray, a unique herbal formula based on the wisdom and tradition of 3 generations of European healers. It is made of the finest all-natural herbs and can be used by people and animals to treat deep or superficial wounds, incisions, insect bites, stings, scrapes, diaper rash, or athlete's foot. It can also be placed on bandage dressing to improve long-term healing and wounds. Toxic chemicals for wound care are unfortunately still commonplace in veterinary medicine and also human medicine. These toxic substances such as chlorhexidine, peroxide, and other chemicals slow down the healing process and tissue regeneration. Overuse of antibiotics also lead to bacterial resistance and formation of superbugs, which can lead to life-threatening infections. Skin Spray is great for healing and also the environment. It is packaged in a convenient, sustainable, and recyclable glass spray bottle and contains no chemicals or antibiotics. Skin Spray is a perfect addition to any emergency kit, and it is also covered with our unconditional satisfaction guarantee. Since its launch 10 years ago, Skin Spray has had an impeccable safety history and currently holds 4.98 star rating out of 5 stars. All you need to do is to go to drdobiaskinspray.com. It is DRDOBIAS skinspray.com and give it a try. Hi everyone. Hi, this is Dr. Peter Tobias, and you're listening to a podcast that is not just about dogs. Today's podcast is inspired by my dog Pax. We often go for little adventures, and this time I took him for a little trip to visit my friend Gabriella on the east side of the island. And it's a really amazing place where there is really wild rainforest with waterfalls and beautiful beaches. And one of the favorite beaches out there is Red Sand Beach. And I've been always mindful about Pax doing varied exercise and making sure that he doesn't overdo it because he's a border collie and he likes to run like crazy. And when we brought him to the beach, it was pretty obvious that he's going to have a really good day. He started running back and forth, and he likes to chase waves and crashing in the waves. And after about 45 minutes, I noticed that he started resting, and I thought, well, this is good. Border Collie knowing how to rest, that's not a bad thing. And we left the beach. The next day, I noticed that he was a little grumpy with another puppy that came to visit. And I didn't really pay much attention to it, thought that he was just, not feeling like dealing with a pup. However, the day after, I took him to the beach and he just did one little run and then he lied down, and I could see that there was something wrong. Whenever I see my own dog injured, I immediately turn into a dog lover and I stop being a vet because I know how many different problems there can be. Muscle sprains, joint injuries, ligament tears, whatever it is. I knew that a young dog not wanting to walk is serious. Naturally, what I did, I started examining his feet and his joints and tendons and muscles and back, and I couldn't really see anything, but he still didn't really want to walk. So we went home and I was really bummed. It was not a good birthday morning. I had people calling me and I didn't feel like answering, and I was feeling really down. When we got home, I started looking again, see whether I missed some sort of thorn or some sort of sliver or maybe a cut on the foot that I didn't notice at the beach. And I couldn't find anything, except I saw that there was a little tiny separation between the skin and the foot pads on the hind feet. I was really relieved because I knew that no matter what, this is going to heal, and it wasn't a tendon injury or a muscle injury or something that could smolder or could become chronic. So this was really the best case scenario, and I was feeling much better knowing that things will heal. But it also was a good reminder how difficult it is for us dog lovers to see our dogs in discomfort, distress, being injured. I called this little episode, or Pax's condition, Elon Musk syndrome. And some people laugh about it because Elon Musk obviously is known for building fast cars and liking to show that they can take off really fast. Pax is very fast in takeoff. However, he too burned his tires or his feet by taking off fast repeatedly. So if you own a Tesla car, make sure that you don't destroy your tires. And if you own a border collie or another fast dog, make sure that he or she gets brakes and doesn't run too intensely on coarse surface. This experience made me think of all the dog lovers out there who are trying to figure out what's going on with their dogs when they get injured. And I thought that it was a good time to put together a little first aid protocol for you to use when your dog gets hurt or when there is lameness, and make sure that you understand where it's coming from and whether you should see a vet or whether you can give your dog just a couple of days rest and it would all be fine. So today I am here to give you this step-by-step lameness examination and first aid protocol. And I hope that you'll not only enjoy it, but you'll also share it with others, because it is super important for us to figure out what's going on with our dogs, because when we know what's going on, then it's easier to make the best and the right decisions. The question that you have to ask is whether you've seen this problem before or not. And if you've seen it before, then it means that there is some sort of unresolved injury that keeps recurring. And the other part that you need to eliminate, or the other problem that you need to eliminate, is a fracture. Fractures are usually very sore, painful in that area. A few years back, I was hit by a car on my bike, believe it or not. I was biking, I was on red light, I was going straight, and the car was turning right, didn't notice me, hit me, I fell on my hand. It really hurt, but I thought, it's just bruised and it's gonna get fine. Eventually I went to the emergency because I couldn't move my hand, and they took an x-ray, told me everything was fine. And 3 days later, when it still wasn't getting better, I saw my GP and he told me I had a fracture that the emergency physician missed. It was a good learning experience because I should have looked at the x-rays, and I just trusted the doctor and he missed the fracture. Anyway, going back to dogs, if your dog has a fractured toe or foot or any bone, obviously he's not going to be weight bearing, and the area will be really sore to touch. So that's something that you need to rule out. When it comes to recurrent conditions and chronic injuries often happen as a result of muscle weakness, which lead to either strain of certain parts on the extremity. It can be ligaments, it can be muscles that tighten. And when these muscles tighten, the other muscle group that is opposing usually gets really weak, or that's the primary actually problem, that they get weak and then the muscles around get tight. This leads to chronic injuries. I often hear people saying, I was absolutely fine and playing soccer and running and doing all that, and suddenly I slipped and I tore my ligament. It usually is not like that. Usually there is gradual deterioration that is either due to excessive muscle tone or, as I said, weakness of certain groups. There can be slow gradual deterioration of the ligaments because there is more movement due to the weakness of the joint capsule and maybe lack of exercise, who knows. But injuries in most situations do not happen suddenly. They, as I said, they happen gradually, and the same applies to dogs. So first thing, decide whether the situation is chronic or acute. And if you have a chronic injury that repeats, you really do need to see a vet or a chiropractor, physical therapist, someone who knows and understands. I often remind dog lovers that veterinarians do not get really thorough courses or education in the area of musculoskeletal rehabilitation and even injuries or spinal manipulation, something like that. Therefore, I always recommend working with a veterinarian and also chiropractor, physical therapy, acupuncturist, or someone who knows and understands how those areas of the body work and how to heal them. The next step is to decide which leg is affected. Remember that when a dog favors the injured leg, the opposite extremity falls to the ground faster, and it happens the same way as if your leg was sore, right? Like the opposing leg will go faster forward to relieve the hurt leg. Sometimes it is rather difficult to determine which leg is affected, especially when your dog has injured back or is weak due to chronic injury or age-related weakness or arthritis. The other thing I want you to know is that leg lameness does not always result from an injury on the leg. It can be coming also from the back. It can be coming from collar injuries. If it's foreleg, dogs often limp when they pull on the leash and the nerves get affected. And when the nerves get irritated that supply the front extremity, because they originate from the neck where the collar pushes on the neck, it can result in lameness of the forelegs. In the hind leg region, or with the hind legs, it happens when the lumbar spine gets injured. Dogs that like to jump, or they slipped or slid and they torque their lumbar spine, they can actually have hind end lameness or weakness. So once again, remember that lameness does not necessarily need to originate from the leg itself. What you will notice that the injured area will usually attract your dog's attention. Dogs sometimes chew and lick their feet or the muscles. They can scratch in certain area. Most dog lovers would think that this happens because they're itchy, but dogs can't really give themselves a massage or rub their muscles or their joints. They chew or they lick, and that's all they can do. The next step in the process of examination is to check your dog's feet. Look for thorns, cuts, swelling, blisters, and do not forget to examine the junction between the skin and the foot pad around the full perimeter of each pad. You also need to check the space in between each toe, because there can be slivers, injuries, cuts. And if you don't find anything and you see that your dog is still sore, there's also a possibility that he or she was stung by a wasp, bee, or another insect like centipede, which happened to my dog Pax. It's important to examine the nails and the nail beds for any signs of injuries. I've seen many dogs kicking their toe, in quotes, and injure their nails. If you see such injuries, it is important to trim the nail back if it's not bleeding. I usually like leaving the nail on when it's shorter, when it's trimmed back, but sometimes it needs to be taken off, and that's something that your vet should do. Obviously, you don't want your dog to be in pain. When you're examining the foot, it's important to feel along all the toes on each foot to observe if your dog is sensitive and reacts. Now, some dogs can react no matter what because they just don't like their feet touched. So it's good to have a baseline before your dog gets injured. I usually tell people that they should handle their dog's feet to make sure that they know and understand how sensitive they are, but also get them used to handling, because if dogs don't like their feet handled, it's really hard to treat them, it's really hard to trim their nails, and it's a pain in the butt. So this is something that you may want to do from if you have a puppy, if you adopt a puppy, or even in an older dog that is sensitive. Handling feet is really helpful and beneficial. Now remember that dogs with sensitive feet may also have some sort of degree of inflammation due to arthritis and old age. If your dog is sensitive and is older, you may want to consider joint supplements. I usually recommend omega-3 fatty acids. I use Feel Good Omega that is made of calamari as opposed to fish or krill, because they're unsustainable. The other thing that you can do is to give your dog turmeric. Ginger is also good for arthritis, and perna mussel, which is also called green lip mussel from New Zealand, and that's better than glucosamine. I do not recommend using NSAIDs because they are harmful to kidneys and liver, and I've seen that in numerous dogs that would be absolutely fine and healthy, and then they would get NSAIDs or non-steroidal anti-inflammatory drugs and end up with kidney disease or liver imbalance. If you would like to do the first aid, you wash the foot really well. I usually take a shower hose, and rinse the whole foot and the nail with water. Make sure that you apply nice bandage after drying the foot, and soak the bandage with skin spray, which is a herbal formula for wounds and healing. I've been using it for more than 15 years, actually almost 20 years, and it has replaced the polysporins and other chemicals for treating wounds with great results. If you would like to see skin spray and learn more, you can go to petertobias.com and look for skin spray. You will find it there. When you're done with foot exam, you want to examine the joints. And any joint is composed of two or more opposing bones, obviously. And the most vulnerable parts are the surface cartilage, the ligaments, and the joint capsule. Now, getting the exact diagnosis is usually more complex. So I recommend you just examining and moving the joints, comparing them on each leg to see whether there is any thickening of the joint capsule, whether there is increased heat or discomfort or change in the shape. And if you discover anything like that, I would recommend that you go and see your veterinarian and get further diagnostics. Ideally, when you're examining joints, move them separately. Look for any signs of stiffness or restriction of the movement or your dog reaction. Dogs usually react to discomfort by looking back or licking their lips, or sometimes trying to tell you by gently nipping, or if they're in real discomfort, if they have a fracture, they can even bite. But I wouldn't blame them because they need to tell you somehow. One of the most common injuries of the hind leg is cranial cruciate ligament injury. And as I said before, it usually is a result of gradual deterioration. Most dogs with cranial cruciate ligaments have lumbar spine problems and injuries. And as a result, the hind leg muscles get tight. There's also a predisposing factor of having different angulation, a little more straight-legged kind of posture. But I have seen many dogs that have cruciate ligament injuries having bad backs. And I think that that's one of the predisposing factors. So if you want to keep your dog well and mobile, it's super important to exercise them, but not over-exercise them, and keep them flexible and make sure that they do not lose core strength. I see many dogs chasing the balls or swimming for hours sometimes, and the muscles that are overworked gets really, really tight. It's super important to do balance exercise and try to get closer to what dogs would do in nature, which is running, playing, and chasing for very short moments, for a few seconds or maybe a minute or two. When I watch dogs in the park chasing the ball all the time, it drives me crazy because I know that they will eventually get injured. And I used to see dogs like that in my practice. So if you have a dog that loves to exercise, make sure that you exercise mindfully and that you restrict the high intensity activity to 5, 10, maximum 15 minutes, and then let them play, let them look around, sniff, and let them do what dogs would normally do. Most people would assume that muscle and tendon injuries happen accidentally after slipping or sliding in some sort of fall. However, based on what I've seen, muscles that get weak result in the opposing or surrounding muscles getting tighter. When this imbalance happens, then it's just a matter of slipping or sliding or some sort of extra stress, and the muscles get injured or torn, and the same with ligaments. Obviously, when there is weakness, there is misalignment as well. There is more stress on the joints and cartilages and ligaments. It all comes along. So if you know that, let's say you have a sore hip or sore knee, it may be because there are some other muscles that are weak, and that applies to humans and also dogs. So how do we examine muscles and tendons? Some muscles may be swollen when they get injured. Others may be just sensitive to touch, but they may not be swollen. They may be tight, firmer than the rest of the muscles around. Dogs usually flinch when they're touching the area that they have injured. They may also scratch or chew or massage the affected muscle. Once again, I want to remind you that chewing and scratching is not a sign of skin disease. Probably 4 out of 5 cases or 8 out of 10 cases. So remember that dogs scratch often when they have tightness or injury or some sort of discomfort. The best way to examine muscles is to do it systematically and press on each muscle. Observe your dog's reaction. Sometimes they look back or lick their lips, or they try to bite if they're really sore. And you shouldn't blame them because, again, they often do not have any other means to tell you that they're sore. In general, muscles heal fast if they're given enough time to rest and recover. Remember, do not use NSAIDs or non-steroidal anti-inflammatory drugs. And instead, you can use turmeric, ginger, and triple dose of Feel Good Omega, which is compared to NSAIDs as effective without the side effects. Now, the last final step of your examination should be examining the neck and back. I usually run my hands along the spine on both sides. And when my thumbs end up in a depression, I just kind of hold the thumbs and maybe press a little bit and see whether a dog reacts. Now, remember that each body part, extremity, organs, ribs, muscles on the whole body relate to certain spinal segment. So if you have a certain segment sore, you may want to go on Google, look at neurology, anatomy of a dog, and see whether that particular nerve or from that particular segment goes to the area that your dog bothers or has injured. Paw licking is a good example. Dogs would lick a paw when they have collar injuries because the nerves from the neck supply the front leg and also the feet. So if a dog is a puller, or if they slip or slide and you have them on a leash, they can actually injure the nerves. They can have abnormal sensation, pin and needle sensation, or whatever else they feel. It's hard to know for sure, but they probably feel very similar to us. The spinal nerve lines can be drawn along the ribs. So if your dog has an injury, let's say in between the shoulder blades, they probably will try to scratch somewhere at the front of the tummy because that's where the ribs from the shoulder blades kind of lead to. So the central portion of the abdomen. As I said, very commonly dogs are diagnosed with misdiagnosed with allergies or some sort of skin problem. However, in many dogs, the skin problems are a result of scratching, excessive licking, or bothering that area because they have an underlying sore muscle or spine. I see older dogs, especially rolling on their back. They're trying to massage their back, and when seeing your dog is rolling, maybe it's just out of fun and pleasure, but sometimes it is also related to discomfort, spinal congestion, muscle tightness, or injury. So what do you do when your dog has a chronic condition that has been going on for some time? Usually it's actually a good idea to see a veterinarian. But once again, as I said, we have not been very well educated in most instances in chiropractics, acupuncture, physical therapy, in the primary veterinary school education. Some veterinarians have taken courses, and that's great, and I really admire them. I have taken some postgraduate courses as well, and everyone is a little different. However, make sure that if your veterinarian is not experienced in spinal alignment techniques, physical therapy, acupuncture, that you look for someone like that. Now, I have seen some states or provinces forbidding non-veterinarians to practice on animals despite the fact that they're qualified professionals, doctors of chiropractic medicine or Chinese medicine doctors with animal certification, animal physical therapist. If that is the case in your state or province, I would highly recommend that you start gathering signatures and make the veterinary college and the government bodies to change this. This is important because in human medicine, physical therapy, chiropractics, acupuncture, massage therapies are absolutely normal forms of therapy. And it is absolutely ridiculous and terrifying to know that some veterinary colleges and bodies actually still forbid other practitioners to practice on animals. I do feel that this is just a form of protectionism and that we really need to try the situation whenever possible and wherever it exists. Now, we're getting to the last section of our podcast, and that is first aid for your dog's acute lameness and injuries. Now, the number one that you want to do is to ensure that your dog doesn't have a severe pain response, non-weight bearing lameness. If he or she doesn't put any weight on the leg, then obviously there's something seriously wrong. If it doesn't go away within a few minutes, let's say something dropped on your dog's foot or they stepped on something, I recommend that you do take your dog to a veterinarian right away. Something happened to my dog Pax just recently. I was at my computer and he was outside, and suddenly he came back and he was limping. Now I examined the foot exactly what as I recommended here, and I found nothing except a little bit of heat and sensitivity in the foot pad. Now I checked the bones around the foot. There was no sensitivity, but when I pushed on the soft area of the foot pad, it was very clear that the problem is there. Now, there was a slight possibility that there was a thorn or some sort of sliver, but I again looked around couldn't see any blood, couldn't see any entry point. I had to assume that this was some sort of insect sting or bite. Here where we live, we have centipedes and they're quite large. And if a dog is inexperienced with centipedes, they may see it as a really nice, fun toy. And I think that's what happened to Pac. So remember that non-weight-bearing lameness can be really serious. There can be fracture. If your dog is limping and you cannot find anything, it can be either a sliver or some sort of thorn or an insect bite. There can be also some sort of exposure to chemicals and caustic substances, but that is not very common. Now, what you do next is to rest your dog for about 1 to 3 days. And I would recommend usually icing the area if your dog allows you to do that, especially in case of acute muscle, joint, or tendon injuries. I tried to ice Pax's foot and he didn't really like it, so I just let him be, because I think that the pressure on the foot was too much, or he was just way too sensitive. I used a triple dose of sustainable omega-3 oil. Now, omega-3s, as I mentioned, are as effective as NSAIDs without the gastrointestinal, kidney, and liver side effects. I do use sustainable calamari oil because fish and krill are no longer sustainable. They have been overfished, and I recommend not using that. Another reason why I don't recommend fish oil are levels of mercury and other heavy metals. I usually see the animals that are lower on the food chain having purer oils and much less polluted. Once again, don't underestimate the effectiveness of omega-3s. I've seen them working wonderfully in practice and also with my dog Pax. And if you triple the dose, it really does work beautifully. You can also use omega-3s in post-surgical situations when there's inflammation and you need cell repair and healing. The other step that I recommend taking is to add turmeric, which is superfood. We all know turmeric from Indian curries, and it is known to be very strong anti-inflammatory agent, as well as it has very promising signs in the area of cancer treatment and prevention. I like to use homeopathic remedies. In case of injuries, I would use arnica. Ideally, get 1 M potency, which is the high potency, and give 1 dose every 8 to 12 hours for 2 or 3 days. Now, if you can't get 1 M potency, you can get 30C or 200C, which are less strong, and administer the remedies every 4 to 6 hours. And if you're wondering what size of pellets, I usually like to give the poppy seed size pellets, and I give you usually about 20 per dose. And if you have the mint size pellet, like little BB gun pellets, there you can give about 3 per dose. That's about all for today. Thank you so much for listening and caring for your dog. I know that your dogs are very dear to you, and I understand how you feel because I live with one too. And if you would like to learn more about how to create healthy and long life for your animal friend, for your canine friend, you can go to my website at petertobias.com. We are also on social, Facebook, Instagram, and Pinterest. And don't forget to subscribe because I send weekly newsletter with healthy tips how to keep your dog healthy and long living. Take care and give your dog a hug for me. Bye-bye.